So this is Beth Minot, speaking to you and now being recorded to tell you about the Spring 2021 GVU IPaT Sea Grant Program. What we're going to do in this session is going to cover a bit of details about the program. And then for those of you who've already seen the link in the chat, this is what we're calling our Give-Get session. So as always, these grants need to be collaborative, and so we're using this as an opportunity to help people find partners for working on particular projects, especially given that the Sea Grant program is a little bit different than it has been in the past. So this is really just me being patter to give you some time to go into the document and start filling out information about yourself, and then we'll spend the rest of the think tank time kind of time dependent on how many people we have and how many people want to present, also kind of telling us a bit about what you're looking for in terms of a collaboration. So I refrained from doing George Burdell, but did myself as an example. So if you scroll down in the document, you can see that looking for things like your name and your contact information, I put that if I was doing one of these, I can't because I have a conflict of interest because I'm reviewing them, but if I was doing one of these, what I would want to do is to work with some folks on how do you increase health equity and understanding the impact of COVID on health. So these are the kinds of questions that I would like to build more capacity in my research group for what I'm doing. And the kinds of things I have to give right now is I have 2 active partnerships that have opportunities for data collection and for prototyping novel experiences. So I have a new partnership with GSU, I just don't have a brain, Georgia State University on looking at the resilience of the LGBTQ plus population during COVID. And so that's an opportunity for interviewing and working with diverse representation from that community. And then I have another program with Emory on the Cognitive Empowerment Program, and we're understanding the impact of COVID on older adults, especially those with mild cognitive impairment that are sheltering in place, safe distancing, and the impact on them. So those are 2 existing field sites, and what I'd love to do is some exploratory prototyping in ways about increasing social engagement during COVID. So that's my example, so modeling by example. So the goal is for folks to start working. I see Lindsay is already in there, and Peter is already in there, so start typing these things into the document. We'll share them today, and then we're going to figure out an appropriate Georgia Tech way to share these things within the community between now and the deadline. So working back to the top, again, this is jointly administered by GVU and IPaT. Also, GTRI kicks in through their partnership with IPaT, so we are pooling together kind of all of the resources that we can find in a very budget-constrained year. Again, want to invest in our interdisciplinary community. We know that you can't do as much in 1 semester as you could in 2. So we want people to pay attention to the fact that we're looking for projects that build our capacity for these types of collaborative projects. So that may be prototyping something up, because if you had a prototype, it would make you much more competitive for other kinds of proposals or other kinds of opportunities. So, something that you would take and have in front of a partner. And Shiva remind me to talk about industry in a minute. Maybe you want to do some qualitative interviewing, do some research surveys, gather more data, and then that data would then fuel a partnership. Maybe you're creating some new methods for how you do research or design and training, especially in respect to COVID, and you're looking for a way to build out and assess and make sense of those methods. So we're looking for things that are capacity building. We're not looking for proposals where you're saying, oh, I promise I can do everything in 1 semester. No, really, trust me. The resources that you can request are pretty much anything but academic faculty salary. So it can be research faculty time, whether that faculty is on the academic side or in GTRI. It can be student time, student GRAs. It can be equipment, materials. The other thing we really don't expect to see is travel or funds for face-to-face experiences, because we don't expect to see any of those during the spring. We do expect the budgets to be pretty modest. Some really maxing out at a GRA and some other work are maxing out on kind of the equivalent time of a research faculty member. Um, and in particular, especially given Georgia Tech's strategic plan and priorities, and given what we've heard from our research community, we're really looking for proposals that orient towards social impact. And so we gave the Sustainable Development Goals from the UN as an example that Georgia Tech has also connected towards and moving our community in that way. That really connects to longstanding IPaT research questions around health and wellness, around taking care of our communities, responding to the challenges of climate change, but it also brings in renewed focus around social justice, around reducing disparities and reducing racial inequities, many of them systemic within our system. So that is a very, very broad umbrella, but gives, I think, a lot of space for our community to respond with fantastic ideas. The last thing I want to say, and Shiva's going to be eavesdropping for this, is that this is not being funded by our industry partners, but certainly feel free to reach out to me and to Shiva and others to say, it would be great if part of the Sea Grant opportunity was to build a relationship with someone on the industry side such that you think they would be much more likely to fund and invest in something going forward. So Shiva, I don't know if you want to speak to any partners that folks could maybe have on the top of their head when they think about this, but you've got between now and Halloween to respond.
Yeah, more than listing out a partner, I think a profile of what your ideal partnerships would be good, and then we can pull from the ecosystem. For example, you could want somebody who's civic-minded or somebody who's specific to your work specifically, and whatever that may be. So basically saying, I would like to work with a partner, or I have a partner, and I want to expand to another domain, or I want a partner in this domain would be ideal. So you could use examples, or you can just be as broad as you want to be. And I think that will give us an idea of who to reach out and how to do some matchmaking.
All right. Otherwise, thank you, Shiva. The proposal process is pretty lightweight. It's all available on the website. I will actually put that in the document as well. Again, we figured it's pretty memorable, but it's due on Halloween. So we hope to get the reviews out within a week or two and give you plenty of time for hiring and for planning for a January start. All funds have to be expended by the end of the spring term, not the fiscal year, but the end of the spring term, because it usually takes that much time for the closeout process to happen. Any questions, live or in the chat? And then we'll go to the give-get section. Going once, going twice.
I have a question. So again, I might not know this program very well, so I apologize. So is this, like, for example, like a lot of the work falling in this space, like a social justice or health and awareness, seems to be cross a specific major or research. So in this case, we may have like a collaborations. Is that something this grant is advocating for, or is this more like a solo researcher thing?
We're much more interested in interdisciplinary collaborations and on fostering new collaborations. So if you say, we've got this great collaboration, we've been working together for 3 years, you don't really need seed funding because you've got something on and going. So looking at fostering new collaborations, and that can be cross-campus. And as I said, it could also be because there's a particular partner you want to work with. We have had these that have focused on building up relationships, with Georgia State and with Emory as well. But building up new collaborative research capacity. Does that help, Dee?
Thank you. Thank you.
Okay. Any other questions? I can't tell if Queen has a question or she's just got a beautiful star shining there. I think it's a beautiful star. All right, let's go into the Give Get section, and the goal is for folks to introduce themselves, kind of provide some context on what you've already created on the Google Doc, and as I said, we'll be sharing this within the community as well for folks who couldn't attend this section. So Lindsay, you got in there first, so really want to hear from you.
Okay, can you hear me?
Yes.
Okay. I didn't mean to be seeming so eager, but I am not apologizing for it. So I am Lindsay Bullinger. I'm in the School of Public Policy. Broadly, my research is seeking to understand the impact of public policies on child health and well-being. And lately, my work has been devoted to COVID-19 related policies because this is a very important and urgent area. But that is not my only research agenda. So I'm looking at other sorts of policies, things like SNAP policies and minimum wage policies, TANF policy, EITC, other sort of social safety net programs. What I can give is I have a ton of data on child abuse and neglect reports. I have other sources of data on similar topics from 911 call data. I'm using some medical records right now, particular to children's child patients. I have a lot of content expertise in this particular area and a pretty expansive network in child for within physicians and public health researchers and other sorts of researchers. Oh, okay. Across Atlanta. Just wanted to make sure that wasn't in response. Across Atlanta, but I am interested in expanding collaborative opportunities across campus. Most of my collaborations thus far have been sort of within the social sciences. So I'm interested in expanding that and learning other methodological approaches that other folks are using.
This is terrific, Lindsay. Thank you. And yeah, do not apologize for getting in there first. This is fantastic. I'm going to keep pushing through, but this is also a great time if you have questions for Lindsay to drop them in the chat or contact her directly. And this can be a pretty fluid document, so anything but deletion. So adding comments and questions in there is fair game as well. Very cool. Peter, I think you're next in the line.
Hi, how are you doing? So, Lindsay, that sounds...
First time caller.
I'm going to start. Lindsay, that sounds fascinating. So, I mean, I'm sure the content of the data sounds like it's would be horrible, but from a data scientist point of view, that sounds like really interesting. We get very excited about anything that's different, and this is not the sort of data I have seen before. So I'd love to talk to you a little bit afterwards about what we might do with it. So as far as me, my interests are wearable electronics, sensors, data analytics, machine learning. A lot of you know about the type of things I already work on, but what I'm interested in is design and implementation of wearable electronics or any devices, small embedded devices, battery operated. Usually it's in the support of research. Sometimes industry partners come in and work with me to develop something that they would like to build. But usually it's a means to an end. What we develop is just so we can grab the data to be able to support the research, the machine learning side of things. I also do a fair amount, because I tend to collect the data, I also do a fair amount of machine learning on the sensor data itself. I have one project now where we're trying to determine activities in a home where we have sensors set up and determine their activities just by power consumption from various devices. So, and then correlate that to to the health of the person and making sure that they are still doing what they need to do, or maybe someone needs to go check on them. I teach classes on how to develop embedded electronics and devices. So I'm always interested in how do we teach this sort of thing? How do we teach embedded electronics to students who maybe have a computer science background but no electronics background? Or I'm working on a project with Clinton now where we're developing a curriculum for students that are middle school students with basically no background at all. How do we bring these concepts to them? And then, of course, this semester I've had to figure out how to take this class that I teach, 3651, CS 3651. It's a traditional lab class. Think of it as like wood shop for electronics and device manufacturing. And normally it's taught in this room where we're all like 32 students and us shoulder to shoulder working on our projects. And I've had to take that and turn it into a completely online class. I have students on campus. I have students in Georgia off campus. I have a student that's on the other side of the world. And I've had to figure out how do I take this curriculum and make it available to everyone. So getting through some of those challenges, I would also like to talk to other folks who may be dealing with that same sort of change in delivery of the curriculum. So that's what I have to give. What I'd like to get is I'm very excited about any data sets large data sets that can be used for machine learning. What sort of things can we pull out of that data that may not be non-obvious? I do have a project that tried to get funded recently for a simple wearable for tracking long-term health, for tracking COVID, the distribution of COVID over a population. I'd like to maybe meet up with some folks who have health backgrounds, medical backgrounds, to take that further. And then, of course, I'm working on another project now where I developed just a device to gather just enough data that can be used as initial data for NIH NSF proposal. So to me, that sounds like this is the sort of thing that this funding is designed towards. Let's see what we can do to put just enough funding into something to get that initial data set, so then we can go after the big enchilada. So yeah. I'm available for all that.
Awesome. This is terrific, Peter.
Thank you.
All right, I'm going to keep us going because I want to make sure everybody gets a chance. But again, questions in the chat and in the document itself are fair game. And Laura, you've been pretty busy, so I want to hear what you got going.
Yeah, so I'm Laura, and I am interested in all things games, and right now I'm really looking for applications. So topics of interest, we have a research initiative called GEAR, which is Gaming and Esports Applied Research. We're doing a lot of esports stuff within that right now, but over the past 10 years, at least since I've been here, we've also done a lot of gaming health applications, teaching people how to eat, how to communicate with doctors, kids, like mobile games apps for kids to help them kind of communicate in a language to doctors and healthcare professionals that's right for them, especially if they're very young. So topics of interest that I have are how you apply games and esports, how you plug those things into these different topics like STEM engagement. So we've been, I've had a couple of these seed grants for helping or figure out how to use esports and gaming as kind of the carrot at the end of the stick to get kids interested in soft and hard STEM skills. General gaming, games for health, games for rehabilitation, games for training, general human factor stuff, AR, VR. What I have to give is all manner of human factors psych expertise. I do for IMTC much of our research design, research material creation, doing the actual implementation of research and the data analysis. And then also within GEAR, we have a suite of industry partners for gaming and esports. And I also have developed like a group of interested schools and educational professionals, if that fits. And I also have a VIP team dedicated to esports. So if there's some plugins there, we have a little group of students that can work on some cool stuff and build things. What I would like to get is, we have all this expertise, interests, partners. I need applications, and that can be really like anything. So thanks Beth for adding the VIP team. Civic engagement, health outcomes, rehabilitation, pain management, social justice, STEM engagement, like it really can be anything at all. So if you have a topic that you feel like would benefit from maybe like a more playful game-like exploration of people kind of engaging with the material in that way, training, anything like that, just please let me know.
Perfect. Thank you. Yeah, no, having an Army and a VIP team is also an important thing to make sure we connect with. All right, so same rules, comments, and questions in the chat and in the document. And then Russ, I see you next on the list. There he is.
There we go. Hey, everybody, Russ Clark. I am research faculty in computer science. Networking is my core expertise, but more recently, much more work around mobile apps and smart cities related Internet of Things projects, and both lots of experience both deploying the infrastructure to support that, but also working with the applications, and then the case of the smart sea level sensors here in Savannah. Lots of experience both on the community engagement side and working in and around the community on this kind of a project, but also just the reality of deploying and supporting a large sensor network. And I'm always looking for potential partners to explore both taking what we're already doing here and taking it to new locations, but also adding in different application spaces. Really neat work going on with the student group on campus looking at air quality sensors right now. And with the Eco Commons coming online, we'll have a good bit of monitoring infrastructure deployed there, which will be much closer to home for collaborations there in Atlanta. So there you go.
That is awesome. I wonder if they're starting to see data of how air quality has changed. I guess Atlanta now hasn't pivoted too much.
Really neat, really interesting air quality data this year, both with the pandemic and the changes in traffic patterns, but also with, unfortunately, all the wildfires. Really, if big data types of analytics are your thing, both with the water monitoring projects, but air quality is a huge one right now, and lots of opportunity.
Very cool. Interesting. Thank you. Thank you, sir. Again, comments and questions in the chat. My intention is that we're going to keep this list up and going so that you guys can keep referring to it, and then other folks can keep adding in. And I see Brian next on the list. I feel like I'm running a radio show or something. It feels very strange.
Right.
Hey, Brian.
Hi, I'm Brian Jones. I am a research engineer in the Interactive Media Technology Center, which is basically part of IPaT, and also director of the Aware Home, which is an authentic home on campus that we've had since about 2000, and looking for ways that we can utilize that home better. So that's actually my one of my big points here. But my interests are in the area of home sensing, supporting home residents, looking at how technology in the home environment can help older adults or people with disabilities. Broader than that, I guess, just health and well-being in general, but the home has tended to be one of my major focus points. The Aware Home provides a resource where we can have a controlled environment. We have a good number of smart home devices or systems in there, and provides, for example, one of the labs that we have situated in the Aware Home is what we call the smart bathroom, and it's a bathroom environment that is sensed to the gills, or maybe I shouldn't say that, but sensed out quite a bit for us to understand transfers. allows for transfers around the toilet as well as transfers. We're working right now on getting transfers into the tub environment. So thinking about how people with disabilities may have challenges in transfer, and this environment allows us to look at that from a quantitative standpoint and as well as qualitative. And eventually we will move that into more of an automated systems approach. So trying to automate the toilet and bathtub or grab bars, I'll say. And the bathtub will move up into the ceiling to allow us to do shower transfers as well. But anyway, getting technology more automated in the home environment to support the needs of the individuals living there. So that was the general idea. So I have a platform, an enterprise level smart home platform that we're using currently for the cognitive empowerment program to get sensor data from the home environments of people with mild cognitive impairment. And that is available to all of campus. So I'm hoping to find ways that we can build on that. Typing. I'm also interested in ways that, so what's important about that platform is it does support like managing of a good number of homes from like your utility or a provider of this type of smart home technology. So that's the main reason we brought it in on the cognitive empowerment program, is to have that kind of control. Also allows for machine learning type capabilities built into the environment. I'm still working with them to figure out the best ways to utilize it, and but as we learn more, I have good ways to guide people on that. I guess most of my experience right now comes from the home environment sensing side of things, and just knowing people out in the community with working with older adults and people with disabilities. And then what I'm hoping to get out of this, I said initially, was we've got the aware home. We want to make sure that we're getting, utilizing the home, and that other faculty aside from myself and a couple others are using it as well. So need to keep it viable. I'm hoping to, what I'd offer or would like to get maybe is if people want to build on some of the research areas that I've mentioned, and beyond the home sensing and empowerment, maybe the whole home gaming was one that was fun for a lot of students to play around with. That's getting away from the single screen and seeing if we can do more active and possibly remote, virtual gaming across homes. Good time to explore that, actually. And then remote work, which Shiva has. I'm sure there are other projects like this, but we just kicked off one with Cisco that Shiva might want to talk further about. But Thomas Plotz, I didn't see him on the call, but Thomas Plotz is leading that effort, and we'll plan on utilizing the Aware Home for that. And I'm hoping to upgrade the sensing in the home to support that project as well. And what is that sleep pattern? So Beth added something. Did you want to say something, Beth? You want me to talk about that?
Yeah, I just love how Shiva and I can just keep adding things that Brian is also interested in doing. One of the things I want to flag for folks is that we really have foregrounded the Aware Home as a laboratory that we're spending more of our time making sure that folks can work safely there, because it's a very unique resource in contrast to other spaces that, just having good access to Wi-Fi. So this, it is definitely a viable resource for doing kind of hands-on research during these times of safe distancing. There's one of the particular partnerships that we have. They would really like us to do more in terms of how do we make sense of sleep patterns and improving sleep hygiene. So anything that is kind of sensing light, sound, any kinds of disturbances are starting to give us some ideas of what we might want to innovate and play with. I think would be certainly welcome. And Shiva can attest to there's a lot of interest in how people can work effectively from home. Imagine that during this time. So the Aware Home is also a great place to build out those ideas in addition to building them in your own house.
Yes, Beth, if I can add, this is a great space if you want to use the home as an asset or a built environment to promote or incubate your research. There's a large number of partners who are now starting to get interested back in the home as a built environment to enable whatever it is, whether it's remote work, whether it's gaming, whether it's productivity, it's tracking mental health to a certain extent, which we have in our Cisco project. So the home has become a focal point for a lot of industry partners back end. So this is a great space, and we have partnerships from people who build furniture to desks to any number of technologies that go in the home. So if you have any ideas that you want to promote in here, that would be fantastic, especially with remote learning as well, which is something that we've talked about. I don't know if Lee McCook is on, but we've talked about, but it's a great space to look at, especially for those who are looking at children and all those kinds of things as well. So just wanted to see some ideas.
All right, so Brian's going to be on all the proposals. So, yeah. But this is
Thank
also
you
a
all
way,
for adding on.
Yep, this is a way for, it doesn't have to be Brian per se that is being funded for this, but more about, funding a student to work in the aware home, taking advantage of the assets, especially the assets that we're prioritizing during this interesting year. Lee, I saw you flash on. Do you want to chime in on this, or should we move to Noah?
I was just letting Shiva know that, yes, I agree, and that's an area definitely of interest.
Yep. So the future of work in the home as well as the future of learning, all fair game. And again, we just have a semester, but this would be the great time to, put together a prototype, a concept. I'll just start to give shape and form to the ideas, and then Shiva will go out and find new funding. So that's how it works. Noah, I think you're next on the list.
Cool. Hi, I'm Noah Posner. I'm a research scientist within the College of Design, so sort of CS adjacent. But I do teach the HCI physical prototyping course, so teaching HCI students how to build things that then they can test, physical objects mainly. My sort of areas of interest are in dealing with electronics prototyping, and particularly how to teach electronics prototyping to people who are not electronics people. So I deal a lot with design students. Physical interaction and how we interact with kind of the world around us, and particularly computers around us that are not screens. And then as well as just general design and making of things, prototyping methods, things like that. What I have to give, I manage the Interactive Product Design Lab within the School of Industrial Design, which we are running at like super limited capacity due to COVID, but we still have a lot of resources, equipment students can check out, and virtual open hours for students to get help and things of that nature, and a bit of space. We also have like robot arms and other various interesting objects. And I'm also going to be teaching a studio course, junior level industrial design studio course in the fall or in the spring, on interactive products. So I will have 20-ish students, 24 students, theoretically a studio space as well in the building. And those students might be an interesting test group for something. Because this is an all new curriculum I'm coming up with, and it's still sort of in progress. So what I want to get, one of the biggest things we've lost this semester, particularly with IPDL, is we've developed workshops that we deliver within the lab where students learn how to solder and make custom sensors and things of that nature. And that's just sort of gone out the window. So I'm really interested in maybe how to teach that to people. Or coming up with ways of shipping kits to people's homes. I'm not quite sure. Could be like an interesting thing. And kind of maybe looking for an academic partner who has some experience with kind of the education side of it, or developing the educational content could be really helpful. But I'm also happy to work with anybody who has cool things. Whole home gaming sounds awesome. And could be a really interesting project for my students to do even. So that's what I got.
That would be awesome. I'm trying to figure out how we're going to do the future of sports, because, you're watching sports and then you start like play acting the sports. And so the future of sports engagement and whole home gaming all coming together. So thanks, no, that's great, and I like this that we're gonna maybe we should flag this in the give-get template, but the studio class, the VIP team, finding productive and interesting ways for students to do exciting research, especially during challenging times. So thank you, that's very cool. Again, questions and comments in the chat. Doug,
Okay, so I'm Doug Bodner. I'm a research faculty member in IPaT. And really, I have a background in logistics and applied statistics. So kind of what I do is data analytics, statistical inference, design in terms of decision theory-based design, queuing flow models, stimulation optimization. I have a VIP team that's been looking at diabetes for a few semesters, so we've gotten some pretty good results, or at least initial results, in terms of treatment design, cost models, how does behavior and motivation affect diabetes, and some data on inequities as well. So really, the topics that I'm interested in tend to revolve around healthcare right now. So designing healthcare processes and logistics, and how does COVID affect that, and how can we actually get around all the constraints that COVID is putting on the healthcare system in terms of extra costs, delays in treatment, those types of things. And then there's the whole piece about healthcare inequities. How do we understand what they are and where they are? And how can we kind of redesign the system to address them? So the types of things I'd like to get are data, or at least data sources, in order to support this type of analysis and research, and subject matter expertise. So I think, like several other people on the sheet here, subject matter expertise in some of these specific areas would be a great thing. And I guess really the focus would be more on chronic disease as opposed to acute diseases. Just kind of understanding how people, flow through the system in terms of all the specialists they may have to go through, and kind of looping back to what Laura was talking about earlier. I don't know if this might be an application for gaming. Potentially could be. So. Questions?
Hey, Doug, it's Richard. Have we talked about the Medicaid data set for any of this, especially for like chronic conditions? There's a lot of focus on children, but then there are adults in there also.
We've talked a little bit about it, but haven't explored it in detail. So that's probably something we ought to think about talking about.
Okay.
Yeah, we really should have done a give-get just on IPaT assets, like, the Aware Home, the Medicaid data sets, other things that we have, possible partnerships. So I think that's one of the things that we need to encourage more fully. But yeah, just this notion of kind of understanding the path through, healthcare, and how the Medicaid data set is one lens onto that, and that could maybe be complemented by other lenses. We can't mash up the data explicitly, but we can certainly ask complementary questions in the work that we're doing. So thank you, Richard. Cool. All right, keeping on Dee. We're to you now. And reminding folks, I think Dee is the closer, so I know there's some folks who are quietly just lurking in this conversation. So even if you just want to speak to the group, drop your name into the document so that I know to loop you in. And then circling to Dee.
Hello. Can you all hear me well? Okay, cool. Yeah, first I want to say I really like this give and get session. This is the first time I'm doing this, and I really like this idea. So I'm Dee Yang. I'm an assistant professor at the School of Interactive Computing within College of Computing. And so the topic of interest that I have, or in general that I'm working on these days, is to build natural language based methods or systems to facilitate some positive and supportive interactions. So what I mean by that, for example, one of the project is to look at how could we help volunteer therapists to chat or provide social support more effectively with patients or clients. So for this, I just built a relationship collaboration with some mental health like nonprofits where we have access to data like how therapists chat with clients. So we are imagining some kind of new interventions. So for example, when therapists are chatting with patients, we try to give some feedback. So for example, here are some best strategies you can consider. And or like here are some kind of template message or the reticence to see, which you can refer to as examples. We are providing like a reflection, the summaries once the session is done. So like a lot of NLP-based applications in this domain. We also work with like American Cancer Society for a few years about like how to better facilitate the social support exchange between like support seekers and caregivers. Since that I can give here, so I mainly work on the computational methods part. So looking at the natural language processing, machine learning algorithms. So we deal with large scale text data, especially like a noisy user generated data. And we apply our methods in addition to the health domain. We also look at like how people like persuade others in their language, like in crowdfunding websites. And we look at the biases in people's language, like how language review, like social biases, societal biases. We look at discrimination in language. My students is looking at like how the Black Lives Matter events and the social movements and how language can provide some insights here. So since that I'm looking for, so we are looking for text-based data and related to health domain, mental health domain. And also like we are looking for like expertise like in the related field. So I wish this could like facilitate like a very fruitful discussion here. I'm also looking for new collaborations with both researchers, faculty, and the industry. So if there are any kind of pointers for that, I would love to get.
Awesome. Lots of possibilities here. I'm writing one in. I know there's a project that we're trying to get underway where Mike Best is trying to make sense of how people are talking about COVID testing in social media so that we can better work with health community partners to deliver testing effectively. So that would be a fun one to encourage you guys to connect on.
Yeah, definitely. Oh, another insight that I got, just like we just got the data, so is that the one of the platform we work with, their like mental health request or like conversations actually increased by 50% since like earlier March. So you can see a dramatic increase. People are all suffering from all these kind of issues, and then if kind of like technologies could facilitate this space, I think that would be really great.
Very cool. Thank you. All right. Shiva's adding as well. Shiva, do you want to jump in? We're just going to keep giving Dee more work to do.
Yeah, I added my notes in there, but I think this is perfectly geared now to what's topical, at least what's been going around, which is school closings, openings. Schools are all making school systems, I should say, are making individualized decisions about how to open, and there's wide disparity. So I think there's a great opportunity to, if they will allow us to work with them, but hopefully leverage somebody like Lena Cook or Lizanne and their contact base to get into these systems to understand the impact of early openings, late openings, or no opening at all, fully virtual systems on the health and productivity of students, teachers, and caregivers. And I think that will cover a full ecosystem. It's a huge, large-scale thing, I can imagine, but I imagine you could start with students and then build it on. But just understanding that data gathering aspect, if the systems will allow us to do, would be fantastic.
Neat. And that we'll take that as a pitch over to Lee, because I know Lee, you're representing a lot of interest as well as some of the resources into this program. So you get the final word.
The final word. Wow. So good to see everybody today. For those who don't know me, my name is Lee McCook. I am a Principal Research Associate, a Division Chief, and GTRI. I see at least one and a couple of GTRI names on here, so thank you for joining us. I hope that you'll reach out to me if you're interested. I've been looking at the ideas, the give-get ideas. We've got the word out pretty late about today's think tank. We're spreading the word about the seed grant funding. It's been announced out to GTRI all, and it will come out in the newsline. So I'm happy to answer any questions if anybody's interested, if you of matching up. But I'm going to do the same as I talk to people from GTRI, looking through this list and sharing ideas. And you know, I've worked with Laura before. We've done a couple of seed grants with cross campus, and we're really trying to look for collaborations to build those collaborations between GTRI and campus in these areas. So I'm happy to help out with that. So reach out to me if I can help in any way.
Awesome. All right. So Lee got the last word. I think what we're going to do is keep this as a live document. I'm not going to blast it out to campus, but we will kind of continue to pass it around in our network. So if you're in there already, come back and check on it, but it'll be a way for you to continue to flesh out ideas and potential connections. And then the main thing is everybody's dumping their contact information in there. So Shiva, make sure your contact information, mine and Lee, is at the top, so that if people have questions about particular resources, and again, while you're enjoying your safe Halloween, that is the deadline for the proposals, and don't go crazy over like this whole home gaming might be catching on right now. So maybe it'd be great that a bunch of people just like jointly submit a proposal on that. So the main thing is I really don't want to see single PI proposals, right? I want to see collaborations. But if it makes sense that, you know, 3 groups get together and ask for a couple students, sure, go ahead and pitch that idea. You know, what we'd really like to see is what people want to work on, and then facilitate that into the proposal process. And then, you know, Shiva is always looking over our shoulder on this to look for ways to match up with possible partners. And then, okay, I lied, Lee doesn't get the last word because Faith gets the last word, which is, I think next week's think tank is on collaboration in pediatrics. So we may have kind of some interesting overlap. I was just on a phone call with Leanne talking about building up more funding in the pediatric research space. So I think we're going to have a nice continuation of that. But Faith, tell me how wrong I was and remind everybody what we're doing next week.
That was right, actually. So look out for a full email description from me soon.
So lots of opportunities. I know it's a crazy time, so everybody stay safe, stay sane. Maybe we should have a teenager swap, like you take my teenagers and I'll take someone else's for a little while. Maybe that's how to stay sane. Just mask them up or something. But it's really good to see folks coming out for this, and really, really excited about people putting in some cool ideas for the proposals. And I'm happy because Thursday night is takeout night. I'm not cooking.
Thanks everybody for joining. That was awesome.
Thank you.
Thanks, y'all.
For doing this.
Thanks, Dee. Good to see you. I wish you were at the beach. I want to go to the beach.
Yes, I am. This is not a virtual background. You should trust me.
Oh, misinformation.
You got it. Okay. Have a great night. Bye-bye.
Thanks.